It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, an Indianapolis company is harnessing the power of artificial intelligence and data gathering to fight the nation's opioid epidemic. Barbara Lewis has more in the Business of Health. Barb?
Gary, thank you very much. Well, hc1.com launched an opioid dashboard that will essentially track opioid abuse in all its facets in real time, giving many entities, including the government and healthcare providers, the information they need to detect problems and respond to them. Joining me now is the CEO of hc1.com, Brad Bostic. It's always good to have you on the show.
Thanks for having me again.
So let's talk a little bit about the origins of your company developing an opioid dashboard.
Well, so we created hc1 really with the focus on capturing lots of data that before was very siloed and disconnected and organizing it into a manner where it's relationships and behaviors that can be tracked, and you can understand who these people really are in terms of what you can do to drive positive change. So as we've built the company and we've amassed lots and lots of connections into all these different silos, our team has really mastered this approach to developing this health matrix that instead of just lots of different siloed data, now you can truly understand how you can unlock answers to solve really big problems. And we've focused that now on this opioid epidemic, which is clearly something that needs to be addressed.
Okay, so what exactly are you tracking? How much?
Sure, yeah. So as it relates to opioids, what typically people understand is how much prescribing is happening, and then we see how many people are dying and how many people are going to treatment. But the whole middle of that story in terms of what are the drugs that are actually in people's systems on a daily basis, that's something that tends to be very difficult to know. And so you're finding out way too far down the path that these outbreaks are happening that lead to things like HIV and lead to very terrible consequences like people passing away. And so what you can see in the hc1 opioid dashboard is geographically, by demographics, by all kinds of different dimensions, what are exactly the drugs that people are truly using across the population today. And so you can start building a more predictive model. So instead of waiting for a hurricane to hit you and then finding out later that you have a bunch of damage to deal with, this is actually helping to predict that these things are coming. So ultimately you can put in place programs to help improve health and reduce the abuse and misuse of these drugs.
So how would the government use this, or law enforcement agencies? What would they do with the data?
Well, if you think about anybody who has an interest in public health, one thing is you can't manage what you can't measure. And so you can invest a lot into, let's say, treatment centers or educational programs or even marketing campaigns on the dangers of these drugs. Unless you have some way to measure whether or not there's an impact on the rate of use and abuse of those drugs actually inside people's systems, you can't really tell whether or not it's working. So this is giving you a view into each geography to see if we do put a program in place that we invest in. Some of these are the federal government's deployed $1 billion to try to address this issue and getting states to help. How do we then answer the question on which are the programs that work? And this is a great way to do that. Okay,
and so for healthcare providers, kind of the same thing is to be able to see what's happening and maybe do some public health efforts around
well, here's an example. If you have an emergency room and they are unaware that some certain synthetic drug is becoming prevalent in their community and they have somebody who shows up in the ER and they're exhibiting strange characteristics, this would actually give them a way to have visibility into, you should probably test for this thing that maybe you wouldn't even have thought of otherwise. So there is definitely an intersection between how this can be applied at the bigger picture public health level and also all the way down to the provider level to just help provide better information so that you can have better outcomes.
Okay, so it's being used in Indiana now?
That's correct, yeah. The state of Indiana is actually very innovative in its efforts to go fight this. And Governor Holcomb has actually made one of his top 3 priorities fighting this abuse of opioids. And so they already had spent several years aggregating a lot of data that's historical data about things like what arrests are and where are you seeing certain types of drugs and so on. We're actually bringing to the table now to collaborate with them this live indicator of what's happening with these drugs that are being used across the population, which can unlock these through artificial intelligence and machine learning predictive models so that we can really collaborate and bring an even higher level of health to the citizens of our state.
Well, Brad, thank you very much for being on the program, and we wish you well.
Thank you so much. Appreciate you having me.